On the 25th May 2014, Sierra Leone confirmed its first Ebola case in Kisiten Chiefdom, Kailan district. The outbreak has worsened over the months and cases have been reported all over the country. The total number of confirmed Ebola-related deaths and confirmed cases continue to rise. Among other strategies to fight the Ebola outbreak, contact tracing is key in containing the Ebola virus.
People that have come in contact with either a dead body or somebody that have died of Ebola or somebody that have sick of Ebola. Those people, we call them contact. And within 21 days, they may fall sick. So that's where the role of contact tracers comes in. So the contact tracers basically, what they do is basically monitor these people that they contact. They monitor them on a daily basis for 21 days.
Surveillance is one of the most important pillars in communicable disease control and prevention because it is the epidemiological tool that allows us to monitor the progress of a disease through the continuous and systematic collection and analysis of data. So we need these contact tracers to actually go out there in the field and interview these people who have been listed as contacts and then monitor their progress over time to see whether in fact they come up with the disease or not.
Considering their importance in the fight against the Ebola outbreak, the UNFPA has been training community health workers as contact tracers.
Contact tracing is a crucial aspect of containing the Ebola viral disease. In essence, anybody who has come into contact with a person who is infected or a probable case should be followed up for 21 days to make sure that if this person develops symptoms, they are immediately removed and put in a holding center. That's the only way to curtail the spread of the Ebola virus disease. Now, UNFPA has trained over 1,500 contact tracers. We have partnered with the telephone companies to ensure that every district in Sierra Leone at least has 100 contact tracers. These tracers are then deployed. They are given telephones, cell phones, they are connected, and they report to the surveillance officers at chiefdom level.
Well, I don't learn today we as contact tracers, we did for really trace the one day where they who say they don't contact the one day where they don't get the disease. For he reports to the medical team for me then take care of the one day where they don't contact the disease. Or for the incubation period where they don't give you 21 days for the disease, who they try for trace any contact.
We believe in working with existing structures, and even over the years we have these community health workers who have been empowered and they are within the community health structures within their respective communities. They have basic knowledge about community health issues.
What actually is the role of contact tracers?
The one day way they don't affected with Ebola, then the one day way after we don't care the victim go, the one day way they kill left behind, where they don't become in contact with that patient where we don't care go, and then with the trace at the community. Well, see say anything or any signs and symptoms we then show so that we go ask we supervisor say this contact don't get signs and symptoms of Ebola, so that he go get that mandate for call the ambulance people then. But then can convey it to the management center.
The 13th me to where I don't get contact with somebody who get Ebola the 13th. Getting from Batia, get a fair where that very 13th. So yeah, I'll be the 14th, I'll be the 15th, auntie. So you know the 20th LE because GT feel we go to Gafila calling because you put every ahani. Now 2 weeks. Call it a lot of William. So you call it William, calling a boy around, then you are valley.
When we can assign at any place, we can go there 2 or 3 times a day. Because some Monday you can go in the morning, you know the meter. Some like can feel sick, but they don't want to expose and say he's sick. So when he see early morning, he can come out. and go out of the compound. But if you go there in the afternoon, maybe you go meet another 10 days so that you will still get in touch with them. If you go afternoon, you don't meet her, you can go evening, you still get in touch with them for let you know how it helps them.
Every chiefdom has about 20 contact tracers who then follow up any contacts and monitor them to ensure that they can report in time. And if there's anybody who develops symptoms, these people are then removed and then put into holding centers. They are then tested, and if they are found to be positive, they are taken to treatment centers.
While if we get any case for trace, now for 21 days, we will monitor them. Then give we a phone where we can get communication with the supervisor at the place. If we don't go to any house, we don't meet a case, when a severe case or you don't report, say it feels sign and symptom, we can directly call the supervisor, give report, so that he go take immediate action, he go see the actual person. So the advice where he go there, because in the medical person, he go give any other advice before.
Contact tracing is the second most important component in this fight against Ebola, because the eradication of the disease itself rests on our ability to identify, follow up, and then take away from the community all those who have the infection, and then take them somewhere where we can treat them.
The result of contact tracing can be seen right through Kailaun district as caseload decreases every day.
With the institution of the contact tracers, we have actually seen a drastic reduction in the caseloads, and in fact I must tell you that we don't have new infections coming in. It's only that the contact that we have, that some of them are now falling sick, some have completed their 21 days, some are still, we are still following up, some they are yet to complete their 21 days.
In Kailaun, initially the numbers were very high, and over time, once the contact tracing system was put in place, it meant that quickly people with symptoms could be identified and then put holding centers, and if they developed symptoms, they are then put to treatment centers. So in essence, it has helped, because if you look at the epidemic graph, it really shows that it went up and then started coming down slowly. So we can say there are results, yes, and the contact tracers have helped in a way. They have made a tremendous contribution.
We know they allow, and let's say no they allow again for let them left lead on a whole stay and sick for 2, 3, or 4 days. The very day where they go meet you, sometimes now let's say they expose. They say, "Well, I sleep today, but I not sleep well. Me head the heart or I feel fever." So immediately we can call the supervisor, let him go supervise you, then you know which sign and symptom where you get, so that he will refer you.